Imagine waking up feeling a bit under the weather. Your nose is stuffy, your throat hurts, and you're debating whether it's just allergies or the start of something more serious. In the past, your only option might have been to schedule a doctor's appointment, drive to a clinic, and wait in line for a lab test. Today, though, you might reach for an at-home test kit, perhaps for COVID-19, the flu, or even your cholesterol levels. These kits promise convenience, privacy, and quick answers. But as they become more common, a question arises. Can at-home tests truly replace traditional lab tests? Let's begin by understanding what at-home tests are. These kits are designed to help you collect samples, such as saliva, nasal swabs, or blood from a finger prick, in the comfort of your home. Some provide immediate results, like pregnancy or rapid COVID-19 antigen tests, while others require you to mail your sample to a laboratory, with results delivered electronically within days. The technology behind these tests is evolving rapidly, and their popularity has soared, driven by the need for convenient, accessible healthcare solutions. But how do at-home tests compare to lab-based tests in terms of accuracy? This is a crucial question, because the reliability of a test can determine whether you seek treatment, isolate from others, or simply carry on with your day. According to the U.S. Food and Drug Administration, FDA, lab tests, often referred to as the gold standard, are typically more sensitive and specific. This means they're better at correctly identifying those who have a condition, sensitivity, and those who do not, specificity. Take COVID-19 testing as an example. PCR tests, which are usually performed in a laboratory, can detect even small amounts of viral genetic material. They're highly sensitive, making them excellent for diagnosing infections, especially early on or in people with no symptoms. At-home rapid antigen tests, by contrast, look for viral proteins rather than genetic material. While these are useful for quick screening, they can sometimes miss infections, especially if the viral load is low. The Centers for Disease Control and Prevention, CDC, notes that a negative at-home antigen test does not always rule out an infection. For some individuals, a follow-up lab test may be necessary. The accuracy of at-home tests depends not only on the technology, but also on how the test is performed. In a laboratory, trained professionals follow strict protocols to collect, store, and analyze samples. At home, the responsibility shifts to you. Missteps, like not swabbing deeply enough, contaminating a sample, or misreading results, can affect accuracy. This isn't to say that at-home tests are unreliable. Many, including those for pregnancy, HIV, and certain genetic conditions, have been rigorously evaluated and authorized by the FDA. Still, the margin for error tends to be higher outside the controlled environment of a lab. So when are at-home tests most useful? The greatest strength of at-home testing lies in its accessibility and speed. If you need a quick answer, say, before visiting a vulnerable family member or returning to work, at-home tests can provide valuable information. They empower people to take charge of their health, encouraging earlier detection and intervention. For chronic conditions, such as diabetes, at-home glucose monitoring has revolutionized disease management, allowing people to track their blood sugar in real time and adjust their habits accordingly. However, not all tests are equally suited for at-home use. For more complex conditions, such as cancer or autoimmune diseases, laboratory tests often involve multiple steps, advanced equipment, and specialized interpretation. A single drop of blood or a cheek swab may not be enough to capture the full picture. For these scenarios, the expertise and resources available in clinical laboratories remain indispensable. Privacy is another important factor driving the adoption of at-home tests. Some people may hesitate to seek testing for stigmatized conditions, such as sexually transmitted infections, STIs, or HIV, due to fear of judgment. At-home test kits offer a discreet alternative, potentially increasing testing rates and enabling earlier treatment. In fact, research published in peer-reviewed journals suggests that making STI testing available at home can help reach populations that might otherwise go untested. Yet, at-home tests are not without limitations. Cost can be a barrier, especially for kits that are not covered by insurance or government programs. There's also the risk of misinterpretation. Receiving a result without the guidance of a healthcare professional can leave people feeling uncertain or anxious. This underscores the importance of clear instructions, robust customer support, and access to follow-up care when needed. Another consideration is the regulatory landscape. The FDA evaluates at-home test kits for safety, effectiveness, and usability before they reach the market. Not all available kits are reviewed to the same standard, and consumers should be cautious about purchasing tests from unverified sources. Health organizations like the CDC and Mayo Clinic advise checking that a test is authorized by the FDA and following up with a healthcare provider, especially if results are unexpected or symptoms persist. Looking ahead, the future of at-home testing is bright. Advances in biotechnology, miniaturized sensors, and digital health platforms are making it possible to test for an ever-expanding range of conditions from home. Some companies are developing wearable sensors that continuously monitor biomarkers, alerting users to changes in real time. Telemedicine has also made it easier to connect with healthcare professionals who can interpret results and guide next steps, bridging the gap between home testing and clinical care. So, can at-home tests replace lab tests? The answer for now is nuanced. For many routine conditions and screening scenarios, at-home tests offer a convenient, effective alternative, especially when speed, privacy, or accessibility is paramount. For more complex diagnoses, confirmation, or comprehensive analysis, laboratory tests remain essential. Rather than supplanting labs, at-home tests are best viewed as partners in a broader ecosystem of healthcare, expanding access and empowering individuals to participate more actively in their own care. Whenever you use an at-home test, remember, results are just one piece of the puzzle. If you have symptoms, are concerned about your health, or receive a positive result, always consult a healthcare professional. They can help interpret your results, recommend follow-up testing if needed, and ensure you get the right care at the right time. Science and technology are making healthcare more personal, but the human touch remains irreplaceable. As you navigate these new options, stay informed, ask questions, and use at-home tests as a tool, not a replacement, for comprehensive, high-quality care. This video is for educational purposes only and does not replace professional medical advice. Please consult your doctor if you have abnormal results.